Hey everybody, welcome back. Welcome back to our P2P daily mobility series. So in our pain to performance series, let's keep doing daily mobility drills. Keep taking notes, taking the high payoff drills that work for you, so this can get a little bit more customized and you can come back, do your daily mobility practice and really do the drills that are the highest payoff or highest impact for you. So today we're working a lot on the hips. Hips and knees. And so I want you to start out with a side lunge just to kind of check a range of motion on a muscle group called the adductors. So if you've seen anybody ever do the side splits, the adductors are the muscle group that kind of open up and allow somebody to do their side split. I'm not there yet, by the way, but you can go ahead and test. And I've never been there either. So it makes a difference. If you started doing that stuff as a kid, usually easier to bring it back or to maintain it. So check as I lunge to the side, how tight does that feel? Is there any pain or discomfort in the leg as I stretch that straight leg? And then retest the other side. Just go back and forth a couple times. Want to make sure that we get rid of that sort of I'm warming up type of concept where when we start out initially, we want to be nice and warmed up so that you don't just blame the muscles maybe warming up sequentially through the movements as we go. It's called the warm-up effect. So do a few to each side, get an idea, okay, how far can I go into it? If you need to hold on to something, perfectly fine, like hold on to a wall, couch, stable object, and sometimes that'll even allow you to drop further into the stretch if you do have something to hold on to. All right, so that's our pre-assess, and hopefully the hips just from that are starting to feel a little bit warmed up. Our first movement today is a ball of foot knee circle. Ball of foot meaning if I'm in a lunge position, we can do knee circles with the whole foot planted, or we can go up onto the ball of foot, elevate the heel. So today that's what we're working on. We're still going to go 3 tempos today, listening to an internal count. So I'm not going to play the metronome. Go internal and think 1, 1,000, 2, 1,000, up to 10 seconds on this first one. So each circle of the knee should take 10 seconds. Okay, so I'll let you go on your own internal count. Let's change direction and come back around. I want to get full range of motion, so all the way forward, pain-free range, and then all the way back to where the knee is locked. Still up on that ball of foot, so we got that heel elevated the whole time. Tall posture, remember spine is long and tall, and we're going to go ahead and start with the knee locked on the other side and go 10-second rep again, or 10-second revolution. Just doing 1 to each side with this slower revolution. So I got 4 movements for you today, but you can go through, of course, multiple reps, especially if you find that this slower tempo is important to keep the movement smooth, and maybe you get a better reassess afterwards. So that's the ball of foot knee circle, 10-second reps. Let's recheck, see what happened with range of motion. Are we same, better, or worse dropping into that side lunge? Again, remember, if you got something handy you want to hold on to, you can. Feeling a little bit better, so I would jot down, hey, slow speed ball of foot knee circle might be a really good warm-up drill, really good before I take a walk, a run, or do a more intensive workout. Or just first thing in the morning, like if you're looking for a great way to get that brain body map warmed up to prevent or reduce chance of injury throughout your day, first thing in the morning, awesome time to do some joint mobility. Closed chain hip circle, we're going to the side. This one actually might be really helpful with our assess reassess drill 2 today. So we're going to side lunge. I'm going to take my hand here and gently press it on the femur. So not up on the pelvis, down on the femur of the straight leg side. This should be gentle. We don't want to like cram down as hard as we can with that hand. Gentle pressure, and that's going to allow us, as we do this closed chain hip circle, get a little bit of a deeper mobilization into what's called the joint capsule. And so we're gonna 10-second rep. I should slow it down a little bit. Come through and around. So what happens, this hip is the focus, but as I do this hip circle on the closed chain, where both feet are down, this knee might be making a little bit of a circle. You can go the other direction. but you're focusing on that gentle stretch, creating some great mobility on that straight leg side. Let's go 10-second rep on the other side. And then we got to go back to ball of foot knee circle, catch up on those other speeds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. That's super slow. Go ahead and go the other direction. And so with these closed chain hip circles, with that light pressure, there doesn't need to be a ton of movement for it to be an effective mobilization. Let's go back. We'll go ball of foot knee circle, 4-second repetitions. So we're, again, working into those faster tempos. Get up on ball of foot. Do a couple one way and do your own internal 4 count. Go the other direction. Good. Let's switch sides. Nice job. And then the other way. Nice. Way to breathe. Way to stay tall. And let's reassess. So see what your side lunge is feeling like and give yourself a grade, same, better, or worse. Range of motion was probably similar there for me, maybe a smidge better, but it felt better. So the knees, the hips, just really feeling better in that side lunge position now. And so if there's less discomfort, we would say, hey, that's a high payoff or a go-to drill as well. Let's go right back to ball of foot knee circle. And if you're comfortable with it, we can go sport speed. As we're in ball of foot, and we're in this lunge, it does challenge the balance. So feel free to hold on for the first couple reps if you need to. And then we're going nice and quick around. And if you shorten up that range of motion, that's okay too. On the faster speed, start safe, gradually expand the range of motion and the balance challenge if you're, again, comfortable and confident in just getting a handle on that movement and the speed of the movement. Let's go ahead and recheck. A retest hip range. Feeling real good. And then we're going to go into that closed chain. We're going back to that one. Now we're going 4-second reps. So we're going to side lunge, create some gentle pressure into that femur on the straight leg side. And we're going to go 1, 2, 3, 4. A couple times through one way and then back around. Again, gentle pressure with that hand. That arm's going to get a little bit of a warm-up or a mini workout here, pushing into the femur. So again, gentle pressure, and we're going 4-second reps here. You should feel just a gentle pull on that inner thigh. Again, keeping that joint capsule healthy and mobile, encouraging good fluid flow through there. Hips are a really important area for lymphatic drainage too. So if we want toxins to get out of the body, good lymphatic flow, got to move the hips. We want to keep them supple, mobile, and strong. So let's retest range of motion. Then we'll go to the faster speed. All right, so now we got fast, close chain hip circle. So we're still going to focus on that straight leg side. I'm not going to really press into this one because with the faster speed, I just really want to be cognizant of not over pressuring. But it would look something like that. So you're just doing a quick drop into that inner thigh stretch. And again, it looks like a mini knee circle over here on that other side if you're paying attention to both legs. Let's reassess. So that was sport speed. And I actually liked, from a comfort standpoint, just for me, you can grade it yourself, make notes in your training journal. I liked the slower speeds on that close chain hip circle a little bit better as far as the response and the comfort level in the hips there. So we're going to move to pelvis full circle next. And so we're going to take that pelvic bowl and kind of roll it through this tipping action. All right, so we're going to bend the knees slightly. And 10-second repetition is our first one. If you know where the pubic symphysis is, the bone in the front here, or the tailbone, bone in the back, if you know where those are and you can identify one of those spots just mentally, sometimes that helps with the mapping of, okay, how do I draw this circle? Where did my circle start in terms of maybe it's the front bone or the tailbone that you're focusing on, and that will help you achieve that smooth 10-second repetition. One way, One the other way, might need to slow it down even a little bit more. Good. And really nice practice on the slow tempo. Let's go to side lunge again, reassess. And that one's feeling decent, maybe a little bit better. Now we're going to go 4-second full pelvic circle. So bend the knees and imagine again, maybe it's the coccyx or the tailbone that you're focusing on. Drawing that circle in space. Trying to keep the rest of your body, your shoulders, your head, your lower body, below the knees, everything else stable, just moving through that pelvic area. 4-second reps, retest. Let's see where we're at. If we do enough retests today, maybe somebody will be able to do the side splits by the end here. From there, we're going to go into the fast sport speed pelvic circle. So knees bent again, and we're going to pull that pelvis around and through as long as it's pain-free through a quick circle there. Let's go ahead and reassess. All right, so feeling pretty good. Let's go to front hip circle as our last movement for today. So we're going to do that in the retraining position, which is if we turn the leg out or in, which one feels tighter? So as I rotate my hip externally, the kneecap points out. When I rotate my hip internally, the kneecap points in. For me, this is my retraining or rehab position for the hip with the knee pointing in. So I'm going to hang out there, try to maintain that foot and knee pointed in position while I focus on the hip driving this leg full front hip circle movement. So 10-second reps. Nice job. Whew. You can recheck, or maybe you already did in a previous video, on which way the hip is tighter on the other side. You're going to hold that position. If you're not sure, for most people, it's internal rotation. So probably 80 to 90% of the people that I work with tend to be tighter in the internal rotators and holding that hip position. Let's go 10 seconds the other way. Good. All right, and that's a little bit of work. So in that internal rotation position, we get this muscle called the TFL, or tensor fascia lata, in the front of the hip to really engage. So one of its jobs is internal hip rotation. So there you go. Try range of motion again, see what we got. That one's definitely feeling better. So no, slow speed front hip circle would be a good take-home drill. Now we're going to go 4-second reps. You got this? We're going to, again, find that position. If it was out or in. And again, if you needed a cheat sheet, it's probably in. If you're not sure, probably need to slow that down even a little bit more for a 4-second rep. But again, you're going internal timing. Let's do a couple. Going back around the other way. Good. And then reassess there. See what we got. I can tell you just on the feel, that's a winner as well. Dropping in with more ease, more comfort. Now let's go fast front hip circle. So front hip means leg is going to be locked. The foot comes out in front of us again. And then speed that up. Good. And other side. Holding on to something for balance. So as we whip that hip around, your center of gravity is taking quite a bit of shift as that weight of that whole leg moves around in space. So the faster speed is going to challenge the balance more. Feel free to hold on to something when you begin practicing those. So let's see, drop in, reassess one more time. And hopefully that is helping your hips just feel ready to move and groove. And also building a little bit of strength there too. So looking forward to seeing you in the next daily mobility. Keep practicing.